Hi, I'm Taylor.
Hi, I'm Luca.
We're going to show you what it's like to come to Sutter Children's Center for surgery.
Just like you, we both had surgery here.
Come on, let us show you around. You're probably here for surgery, where a doctor called a surgeon may fix a part of your body. It's normal to be a little nervous, but the people you will meet are all here to help you and can answer any questions you may have about your surgery. First, you will check into the Pediatric Day Unit waiting room so the doctors and nurses know you are here. They will give you an ID bracelet with your name and birthday on it. Your nurse will come and get you and 2 of your family members. The nurse will need to know how much you weigh and how tall you are. Then you will go into an exam room where you'll put on hospital pajamas and socks. While you are waiting, there might be activities, toys, or even a movie list to choose from. The nurses will want to check your vital signs. Do you know what your vital signs are? Your vital signs are things like your heartbeat and temperature. The nurse will listen to your heartbeat with a stethoscope. That's called a blood pressure cuff. It feels like a tight hug on your arm or leg. The nurse will use a thermometer to check your temperature. She might check it under your tongue or in your armpit. The nurse will need to know how much oxygen or air you have in your body. She will put a tiny Band-Aid with a little red light on your finger or toe. This is called a pulse oximeter. You will meet someone called a child life specialist. Her job is to make sure you understand what to expect when you have your surgery today. You and your family will talk with 2 kinds of doctors. One doctor is your surgeon. The other doctor is the anesthesiologist, the doctor that gives you your sleep medicine. This doctor will talk with you about the medicine you will have to sleep. Sleep for surgery is different from when you are asleep at home in your bed. When it's time to go into the room where you are going to have your surgery, a nurse from the surgery area will come help push your bed into the operating room. Sometimes smaller kids can go in a kid-sized car to the surgery room, or you might be carried by your child life specialist. Once you and your bed are in the hallway, you will give your family a hug and a kiss so they can wait for you in the waiting room until your surgery is over. This is the room where kids get their sleep medicine and surgery. The staff that work in the surgery area all wear clothes called scrubs, a hat and mask. They wear these outfits to keep it really clean in the room where you get your sleep medicine and have surgery. See this soft round-shaped object? It's a pillow. The machine behind this gives you the sleep medicine. Some kids breathe their sleep medicine through a mask. Other kids get their sleep medicine through an IV, which is a short name for an intravenous catheter. Your anesthesiologist will decide what is best for you, and your child life specialist will help you make a plan on what you want to do when you fall asleep. Some kids like to count, play on an iPad, or hold someone's hand. See those lights? They might be a little bright, but they won't touch you. The doctor uses them to see better. When you're asleep for surgery, you won't feel anything. You will sleep the whole time. When the surgery is over, your anesthesiologist will stop giving you your sleep medicine. Then you will wake up in the recovery room. When you wake up, you might get a popsicle, juice, or water. Before your surgery, it's important to not eat or drink anything for a little while because the sleep medicine helps your whole body fall asleep, including your stomach. If you have food or drink in your stomach, then it may get sick and make your surgery unsafe. When you are ready to leave the hospital, the nurse will gently take the tape and IV off your hand or arm. It feels just like taking a Band-Aid off. If you are spending the night at the hospital, then you and whoever brought you will go together to your room. There's a playroom with fun things to do while you are here. When the doctor says you're ready, then you'll get to leave the hospital.
You did it.
Great job. And now we're going to share 10 of our favorite things about Sutter Children's Center.
The playroom. Pillow stuffed animal.
Artifacts.
Nurses.
Goo.
Sophie's place.
The facility dogs.
Child life specialist.
The team room.
It's in the camera.